Perimenopause. Perimenopause represents a critical transitional phase in a woman's reproductive life cycle, marking the gradual cessation of menstruation and fertility. This period is characterized by significant endocrine fluctuations, primarily involving estrogen levels. Typically commencing in a woman's fourth decade of life, perimenopause can persist for several years, with an average duration of 4 years. The onset and progression of perimenopausal symptoms vary widely among individuals, necessitating a nuanced understanding by healthcare providers to ensure optimal patient care and management. Biological basis. The biological basis of perimenopause lies in the changing dynamics of ovarian function. During the reproductive years, the ovaries maintain a cyclical production of estrogen and progesterone, regulated by the hypothalamic pituitary gonadal axis. As perimenopause approaches, there is a gradual depletion of ovarian follicles, leading to a decline in viable oocytes. This depletion results in less predictable hormone production, particularly marked by erratic fluctuations in estrogen levels. These hormonal perturbations precipitate a cascade of physiological effects throughout the body, manifesting as the characteristic symptoms of perimenopause. Perimenopause, or menopausal transition, occurs on average at age 47. Menopause is officially reached after 12 consecutive months without a menstrual period. It happens around age 52. Signs and symptoms. The clinical presentation of perimenopause is diverse and can vary significantly among women. The most prevalent symptom is menstrual irregularity, which may manifest as alterations in cycle length, flow volume, or frequency. Vasomotor symptoms, particularly hot flashes and night sweats, are also common and can significantly impact quality of life. Many women experience sleep disturbances, which may be exacerbated by nocturnal vasomotor symptoms. Urogenital symptoms, such as vaginal dryness and dyspareunia, often emerge due to declining estrogen levels and subsequent atrophy of vaginal tissues. Mood lability, including increased irritability and emotional sensitivity, is frequently reported and may be attributed to the neuroendocrine effects of fluctuating hormone levels on neurotransmitter systems. Diagnosis. The diagnosis of perimenopause is primarily clinical, relying heavily on a comprehensive patient history and the presence of characteristic symptoms. While serum hormone assays are available, their utility in diagnosing perimenopause is limited due to the significant fluctuations in hormone levels during this period. Follicle-stimulating hormone levels, FSH, often used to confirm menopause, can be misleading during the perimenopausal transition. Therefore, clinicians should prioritize a thorough evaluation of the patient's symptomatology and menstrual history over isolated laboratory values. Effective communication and a detailed assessment of the patient's experiences are paramount in accurately identifying and managing perimenopause. Management. The management of perimenopausal symptoms requires a multifaceted approach tailored to each patient's individual needs and risk profile. Lifestyle modifications form the cornerstone of initial management, including regular physical activity, balanced nutrition, and stress reduction techniques, such as mindfulness or cognitive behavioral therapy. For patients experiencing moderate to severe vasomotor symptoms or genitourinary syndrome of menopause, hormone therapy may be considered. Hormone therapy typically involves low-dose estrogen or combined estrogen-progesterone regimens, with a decision to initiate therapy based on a careful assessment of potential risks and benefits. For women who are not candidates for or prefer to avoid hormone therapy, non-hormonal options such as selective serotonin reuptake inhibitors, SSRIs, or gabapentinoids may be efficacious in managing vasomotor symptoms. Phytoestrogens and other herbal supplements have shown variable efficacy and should be discussed with patients interested in complementary approaches. Risk of hormone therapy. Hormone therapy can help manage menopause symptoms, but it comes with certain risks, such as an increased risk of uterine cancer if you have not undergone a hysterectomy and are taking estrogen without progestin, a higher likelihood of heart disease if hormone therapy is started more than 10 years after menopause begins, and a greater chance of developing blood clots, stroke, and gallbladder disease. Additionally, long-term use may slightly elevate the risk of breast cancer in some individuals. These risks vary based on overall health and family history, making it crucial to discuss your individual risk factors with your healthcare provider before starting hormone therapy. Patient care. Providing comprehensive care to perimenopausal women extends beyond symptom management. It is crucial for healthcare providers to offer evidence-based information, empathetic support, and individualized counseling. Addressing patients' concerns about the physiological changes they are experiencing and providing reassurance about the transient nature of many perimenopausal symptoms can significantly alleviate anxiety. Patient education should encompass discussions about long-term health implications, including bone health, cardiovascular risk, and sexual well-being. By fostering open communication and tailoring management strategies to each woman's unique circumstances, healthcare providers can empower patients to navigate this transition with confidence and maintain optimal health and quality of life. Take-home message. Perimenopause represents a complex and individualized phase in a woman's life, requiring a nuanced and patient-centered approach from healthcare professionals. By recognizing the diverse symptomatology, understanding the underlying endocrine changes, and offering appropriate management options, clinicians can significantly impact a woman's experience of this transition. The goal of care should be to alleviate bothersome symptoms while promoting overall health and well-being. As our understanding of perimenopause continues to evolve, staying abreast of current research and guidelines is essential for providing optimal care to this patient population. Question number 1. What is the average duration of the perimenopausal phase? The correct answer is C. The average duration of the perimenopausal phase is about 4 years. Question number 2. Which hormonal fluctuation is primarily responsible for perimenopausal symptoms? The correct answer is A. The hormonal fluctuation is primarily responsible for perimenopausal symptoms is a decrease in estrogen levels. Question number 3. Which of the following is not a common symptom of perimenopause? The correct answer is C. Common symptoms of perimenopause include hot flashes, night sweats, vaginal dryness, genitourinary symptoms, and irregular menstrual cycles. Question number 4. Which diagnostic criteria are used to confirm the onset of perimenopause? The correct answer is B. Irregular menstrual patterns and fluctuating FSH levels are diagnostic criteria used to confirm the onset of perimenopause.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.